This is the recording for the Occupational English Test, and the test is held at MedCity International Academy, Calicut on 27/10/2022. The candidate's name is Agina Raju and the candidate number is 638795. The interlocutor is Srihari K. Nair and the interlocutor number is 4328. This is role play number 1 for the profession of nursing. Good morning, Agina.
Good morning.
May I see your identification, please? Okay. Okay, thank you. Well, this is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. Okay?
Yeah.
We will move on to the warm-up session to get you started. This is not in any ways assessed. So, shall we start?
Yeah.
Well, Agina, could you please tell me about yourself?
Okay. My name is Agina. I'm coming from Pulpalli, which is in Wayanad. I have a happy family, which includes my mom, dad, and sister. I just completed my BSc Nursing from NIMS College of Nursing. Currently, I'm looking for a good platform to build up my career.
Well, okay. So, why did you choose nursing?
I chose nursing because it is a service-oriented profession, and it inspires me a lot by my family members to take nursing as a profession. Besides that, it provides me wide opportunities to get a job.
Okay. So, who is your role model?
Yeah, I have a role model that is none other than my sister. She is also a nurse. The way she take care of the patients inspired me a lot to take she as my role model.
Okay. So, could you please tell me about your hometown?
Well, I am from Pulpalli, Wayanad. It is situated in northern part of Kerala. It is enriched with mountains, rivers, ponds and valleys, especially the Western Ghats, which makes it a beautiful place.
Well, okay. So, what are the advices that you would like to give for the upcoming nurses?
As a nurse, I can give them a bunch of information regarding the medical profession. That
Okay.
is, I definitely advise them to update their knowledge each and every day, because medical profession is changing day by day with the current and other alternative methods that they can follow. So I advise definitely them to update their knowledge.
Okay, well, let's move on to the role play session now. I'll be taking the part of the patient and you take the professional role. The role play will last a total of 5 minutes and you will be given 3 minutes to prepare for the same.
Okay.
The role play intended to get evidence of your ability to perform effective communication with the patients. Do you have any questions?
No, sir.
Okay, so you will have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so. Here is a pencil. You can look at the role play card during the test, but must return it to me at the end.
Okay, sir.
Okay. Okay, so that will be the end of your preparation time. The role play card will last 5 minutes. Don't worry if I stop you when the time is up, and you can begin now.
Good morning.
Good morning.
I'm Agina, one of the registered nurses working in this hospital. May I know your name?
My name is Jerry.
Okay, Jerry, nice to meet you.
Okay.
Can you please tell me the reason for your visit?
Well, I was scheduled for a hernia repair in 2 months.
Okay.
And I've been told to quit smoking before the surgery.
Oh.
Well, I'm a bit confused about that thing, and I'm a heavy smoker. So I came here to ask you about this thing, like why do I have to quit this habit before my surgery?
Okay, before moving further, can I ask you some questions to get a clear picture of the situation?
Sure.
Okay, can you please tell me regarding the onset and the amount of cigarettes that you daily take?
Well, I've been smoking for like 30 years or something like that.
Okay.
And I smoke like 15 cigarettes per day.
Okay.
And I've tried several times to quit my habit, but I've never been successful.
Oh, don't worry. I'm with you to help you to overcome this situation.
Okay.
Anyway, please tell me the methods that you have tried previously to quit the smoking.
Well, I try to cut down my cigarette intakes. Other than that, I haven't done anything. I just try to quit my habit by my own, and I have never tried anything else.
Okay, have you ever tried smoking cessation programs, hypnosis like that?
No.
Okay, don't worry. Anyway, I will give you some informations regarding how to quit your smoking.
MedCity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
Well, before that, I would like to ask you that, what is the need for quitting smoking before my surgery? I don't get the idea behind that.
Okay, that's a good question from your side, because if you're having an idea regarding that, then only it will promote you to quit the smoking.
Okay.
I will give you explanation regarding that. There is a chance of getting post-operative infections, lung complications, heart complications, as well as anesthesia difficulties for you if you are continuing with the smoking. Do you know what is this anesthesia difficulties?
Well, I have no idea.
Okay, I will tell you. If you're continuing with this tobacco products, means there is a chance that your lungs will be aggravated. Okay, so that it is very important for you to quit smoking now itself for a successful surgery.
Well, I don't think I can quit my habit because I've tried several times to quit my habit of smoking cigarettes, and I've been smoking for a long period of time, so I don't think I'll make it.
Okay, I can sense your feelings, but don't worry, definitely I'll help you. I'll give some advices to quit your smoking. There are many methods present in our within hands, so we can use that to overcome the situation.
Okay.
Before moving, can you please tell me your smoking routine?
Well, I do smoke in the evening time. I do smoke a lot in the evening time.
Okay. Is there any triggering factor for you?
Well, I'm a short-tempered person, so whenever I get tensed or whenever I get angry, I just smoke some cigarettes so that I can get a relief from it.
Okay, from your case, I can tell you that we can just replace your smoking routine. If you get a sense to take cigarettes, definitely you can involve in exercise, yoga, meditation, like that alternative methods.
Okay.
And also, you have mentioned that you are a short-tempered person.
Yes.
Okay, for that, if you feel any angry, you can just use a smiley board. By pressing that, you can relieve your stress as well as your angry.
Okay.
Thereby, you can overcome your triggering factors. Are you getting my point?
Well, I do get your point, and your suggestions are pretty good.
Okay.
But I think I'll try these nicotine patches.
Okay. If you are still moving with nicotine patches or any other therapies that involve nicotine, there's a chance in which nicotine will still present in your blood.
Oh, I see. Okay.
So we can use alternative methods, that is avoiding by nicotine like techniques.
Okay.
Is it clear for you?
Yes, I do understand what you're saying, and thank you for your suggestions. I'll definitely follow them.
Okay.
It would be better if you give me some information regarding some other support groups or something like that.
Yeah, definitely, because there are support system while convincing your mind, you will be able to overcome from this tobacco as well as nicotine products.
Okay.
There are many counseling sections in our society and also support groups available. I will give you the contact number so you can contact them and also involve in that. Is it clear for you?
Yes, it's clear for me.
Okay, do you have any other concerns or anything to share with me?
Well, I don't have any more concerns. I got a picture of my condition.
Okay, till now we have discussed regarding for the methods we can do for quit smoking. That means you can involve definitely you can involve in community sector by using the support system available in our society itself.
Okay.
Okay, don't worry. In addition, I will give you a leaflet. So whenever you reach home, you can go through this leaflet, the alternative methods such as yoga, meditation and all. Is it clear?
Yes.
Okay, I wish you quit smoking as soon as possible, and I wish you to have a nice day.
Thank you. Okay, that marks the end of your test. Please return the roleplay card to me. Thank you very much.
Download MedCity OET app, available on Play Store and App Store.